As you see, this paper was published in 2005. And by the way, I realized two things. It was never read. It was not understood. And absolutely forgotten about two problems which was discussed today. One is creatinine, happy, and the other is staging. But just if you want to look on the staging, you have some data in this paper. So I will not speak about future, nothing. I just want to come back in 10 years later and speak about very funny things who came in my mind during when I examined patient. That was I have seen in this patient that creatinine was sometimes not normal, going down, and so during the French extension of the result trial, phase 4 trial, I asked to check for creatinine and other markers just to have a look. So if you have 2 minutes, you go to the original article, and basically the creatinine part of this article was based on more than 2,000 patients, usual patient, as you see, with slow duration, disease duration, regarding to the previous result trials, and number of patients was died, as you see, 800 patients died. What we observed, creatinine was checked every 3 months, but most patients have evaluable data about creatinine, but we enter only creatinine at entry in the trial. The other was lost by Sanofi, definitely, as many things. And after, as usual, manipulating the data, we decided to have a cut point at 60 millimole per liter, and we looked for survival relationship. Mostly because at that time, I'm sorry, I was interested only in survival, and I remain. That's definitely a separation with United States part of the world, but I think survival still has something to do with ALS. And we looked for univariate in the Cox model, and you see that creatinine. I don't know if we have a creatinine. The relative risk was 0.5, meaning that the risk is decreased by half if you have a high creatinine level. We check for other biological data, and probably if you are interested, neutrophil has also something to do, but it's just a suggestion. We in the multivariate Cox model, we had 11 variables, 11 parameters. Age, as usual. Disease duration, as usual. Creatinine, which remained important in the model, 0.7 at relative risk. Atrophy is interesting. Pyramidal signs, it was the first time we shown that most the patients are spastic, or pyramidal, the longer they survive. So spasticity was also interesting and important. Fasciculation, muscle strength, I don't know if it's interesting. Cough and swallowing and slow vital capacity. So definitely creatinine was kept in the model and was a very strong indicator of survival. Here are it's the survival curves below and above 60 micromole. And so, you know, you see that there is a large difference. This is not in the paper, but we observed that there was a relation between creatinine and atrophy. We check very in a simple way atrophy, visible atrophy, but we didn't check with function. As I told you, we have no more than the original data, and I'm not able to check for. I think it's possible to get them back, but probably in 10 years it will be possible. Just to come back to the what we call the extended score, the creatinine was, of course, still in this score, but the neutrophils counts is important, and not the increase as you expect, but the decrease of neutrophil is correlated with survival. The shorter survival is correlated with the decrease of neutrophil, which was at the moment reported to as a side effect of riluzole and probably not. And at that time, 10 years ago, we looked for a possible other correlation, but we had no clear signal. So this is no more important. Just because creatinine is important, just to come back to possible other marker of survival, I don't know what to do with them. As you know, it's ApoE in blood, which is related to survival and also to function. This was in 2002. The glutamate, which we know it's increasing 2/3 of the patient and related with disease severity. As expected, glutamate has nothing to do with real tech. I mean, we check for the glutamate levels in CSF during the real tech trial, and we had absolutely no correlation, nothing. Lipids was published with Luc Dupuy, and this was largely discussed, but it remained that high lipid level is a good correlation with lipids are very often elevated in ALS patients, and there is a relation between the ratio of LDL and HDL and survival. Our group with Pierre-François Pradin and others, we observe a relation with glucose intolerance, but we did not observe any relation with clinical data and these markers. Recently, with Luc again, we published the result of serotonin levels in blood, in the platelet serotonin, as you see, is largely decreased in ALS patients. And this is interesting. If you are interested, we had a very small, we examined the platelet, and the coagulation is not exactly normal in ALS patients, probably related to the platelet serotonin, but there is a relation between the serotonin levels and survival. And I think this is for young people, the old one speaking to the young one, probably it could be interesting to look further on this point. Recently with Yan Lajan and our group, we published that ferritin is, this is known, but ferritin has something to do also with survival, and high ferritin levels is a marker of, is a bad prognostic for a patient. So I've nothing to do as to tell you as a conclusion, except that I have many questions. I don't know if all these markers are specific. Probably we have to check for that. Is it specific of the disease? Is it specific of all patients? Is it specific of a group of patients? And probably this is always the story of heterogeneity. Are they useful in clinic? Just to tell you, I use in my daily clinic this marker. When I have some difficulty for diagnosis, I like to check for creatinine before and after many patients check for creatinine before and after the beginning of the signs. I am looking for creatinine, ferritin, and of course creatine kinase. But these markers can be very useful. And just for the small story, I'm very impressed by the time of appearance of high cholesterol level in this patient. I have just a feeling that it could have something to do with muscle involvement and the disease itself. So I think we have to look for a mechanism of these markers and, of course, other markers. I don't know what means the correlation, but just I'm glad that now creatinine seems very, very interesting, because when I spoke at that time of creatinine and muscle in ALS, everyone was not exactly laughing, but thinking that I was a little simple, crazy. Thank you.